This video is based on my birth story with Jasmine. So the story starts, I believe it was a Thursday, and I noticed that I was leaking some fluid.
Are you okay? Do you want to talk about it?
I just sprung a leak, that's it.
You're leaking.
I'm leaking.
Okay.
And it wasn't discharge, it wasn't anything that I'd seen before, it's just like water. And my husband said, "You've been losing your control of your bladder, maybe you just peed yourself." And I said, "No, I think I noticed if I peed myself." So it wasn't pee, it was just clear liquid. The next day was my actual doctor's appointment, so I told them about the amniotic fluid, that I'm pretty sure it was, and they did a more thorough test, and they did find that I had been leaking amniotic fluid. Now, my water didn't break or anything, there was a rupture in the sac somewhere that it made the amniotic fluid leak out. So they went and they talked to the nurse and the doctor about if they should keep me or not, and they decided that since I was a week overdue, and I was 41 weeks, they decided that they would keep me and induce me. So around 6 p.m. they kept me, they registered me into the hospital. I had my IV and my gown in my room, and I couldn't believe, I was like, is this really it? Is this really it? We're having the baby? Like, tomorrow we'll have a baby? And they were like, yeah. So I was excited. My husband called his job and said, I won't be there for the next couple of days, I'm having a baby. So it was really exciting. And they hooked me up to contraction monitors and a monitor for the baby's heartbeat. And the contraction monitor said I was having contractions, but I didn't feel anything. I was fine. I was listening to Bob Marley and eating food and walking around and just chilling out. It was fine. And then that's when they started me on the oxytocin. And the oxytocin made the contractions come faster. So everything was fine and happy, and then all of a sudden things got really serious. They started to really hurt. Yes, yes, you want to be heard. Hey Jasmine, say hi Jasmine. I'm talking about you. Yeah, you making all that racket? Anyways, so the contractions got more and more intense, and then my concept of time went... She wants to tell the story. Oh, burp. So, like I was saying, the contractions got more and more intense, and I lost concept of time. At this point, I didn't know what time it was. I just knew that, like, the contractions were coming and coming and coming. And at that point, they decided to break my water.
They broke my water. They broke your water? Do you want to talk about it? How did it feel?
Warm.
Warm.
Once he broke my water, things picked up even faster. And contractions were right on top of each other. There was no break. When he did that, he had checked me, and I was 4 centimeters. So they said that once you break the water, it could still take a lot of time. So we sent my mom and my sister home. They only live 5 minutes away, so we sent them home to get some sleep because it was the wee hours of the morning now. And after that, after contractions, like they said, why don't you try to sleep in between contractions? And I couldn't. They were right on top of each other, and they were so painful. So I couldn't sleep. In another hour, they came and checked me again, and I was 9 centimeters. So I went from 4 centimeters to 9 centimeters in 1 hour. So my husband got back on the phone and called my mom and my sister and said, come back, she's 9 centimeters. And I was feeling the urge to push like crazy. I just when you have the urge to push, you have to push. There's nothing, you can't control it. Your body just starts pushing. And the nurse said, don't push, you can't push yet, you're not 10 centimeters. And I was like, how am I supposed to control this? Like, how can you not push when you have to push? So I tried to control it the best I could, and I couldn't. Again, I'm still doing the controlled breathing with my husband, just trying to concentrate on his voice. And then I was only 9 centimeters for about 10 minutes. And then she checked me again, and I was 10 centimeters. So I was like, can I push? And she's like, yes. So I just pushed my heart out. I've never worked so hard in my life. I pushed so hard. And they say that you try to get 2 pushes during one contraction. The first push and then the second push is more powerful, because you need, like, when you, in between pushes, the baby will come back in a little bit. So if the second push is stronger, it will push it out faster. So that's what I was trying to do. I pushed my hardest, and then for the second one, I tried to push even harder, and I was doing it. I used everything in my body to do it, and at this point, still no drugs. So I was just pushing, and the doctors and nurses were just watching. They were like, wow, wow, she came down really far that time. Wow, you're really doing it. You're doing a great job. And the encouragement really helped. I just wanted the baby out at this point. She's right there, stretching everything, and it hurt. So I just wanted to push the baby out. And I did. She pretty much flew out. One of the nurses was like, all the nurses and doctors were like, whoa, they jumped back because it startled them. She just flew out. And as soon as they flew her, like, she came out, they cleaned out her mouth a little bit and gave her to me. And I checked if she was a girl, because her nursery was already pink. So the first thing I checked for was that she was a girl. And she was the most beautiful baby I had ever seen. She was very clean, and she wasn't gucky, no chunks or anything like that. And she was very clean and beautiful, and I fell in love right away. Such a precious little face, and it makes all that pain worth it. I only got to hold her for about 10 minutes while they were taking out the placenta, because I had torn a lot on the inside, which I don't know how that works, but I only tore on the inside, not the outside. So they had to stitch me up. I was stitched up for about an hour and a half afterwards, and for that hour and a half I couldn't hold my baby because I was very shaky. I couldn't control it. Like, my whole body was convulsing. I lost a lot of blood, and I don't know if that's TMI, but anyways, you asked. And so they stitched me up for an hour. I had about 20 stitches on the inside, and so the recovery was about, for a whole week I couldn't really walk, and then it got better and better and better. So it was rough at the beginning, but I had my husband who helped me so much, and it's really important to have a good partner to help you through it, if it's a husband or a best friend or a mom, just someone there to help you, because he was the biggest help I could ever ask for. I couldn't get out of bed, so he did the first diapers, the first bath, first everything he did, and he took care of me as well, not only the baby. So it brought us so much closer together to see that he took care of me so well and the baby so well. He just really stepped up, and I love him so much more for it. So that was pretty much it. She came out, and then they fixed me up, and then I got to hold her, and the rest is all history. She was such a good baby from the beginning, and she's still a good baby. She's sleeping right now. See my good baby? She's such a good baby. So that's my story. Yeah, so feel free to ask me anything you want, and I'm a pretty open person. I'll answer any questions I can to help you out. So I will see you next time I make a video. Thanks for watching. Bye!